Dr. Saikat Patra, Associate Professor in the Department of Neonatology over here at Himalayan Institute of Medical Science, Jolly Grant. And now we are going to discuss about the primary newborn care. A very important topic, because after we pass out from MBBS, we will be all dealing with the newborn, and all the expectant mothers, the parents, or any of our own family relatives or the neighbors may come and ask us what are the various things that needs to be taken care in this newborn. And as a MBBS graduate, we must be in a position to tell them what are the basic essentials of a primary newborn care. So in this lecture, we will be discussing about those aspects. The first and the foremost important aspect is the breastfeeding essentials. First feed in a newborn should only be the mother's own milk. Exclusive direct breastfeeding or expressed breast milk in cases of preterm babies must be advised. It should be clearly told that water should be avoided, honey should be avoided, janam gutti or gripe water should not be used in any scenario. Colostrum, which is the first thick milk which is secreted by the mother, must be fed to all the newborn babies. Bottle feeding is a strict no, and feeding time in a healthy baby may vary between 10 to 15 minutes. Feeding from one breast completely followed by the other side must be clearly told to the mother, because in the breast milk the initial part is the fore milk which quenches the thirst of the newborn, and the hind milk is the thick milk which will satisfy the hunger of the baby and will actually lead to the improved growth. So if the mother feeds from both breast at the same time, then the newborn gets only the fore milk. As a result, there may be poor weight gain. Hence, feeding from one breast completely before switching to the other side is very important. Burping is also essential after every feed, and it may take as much as 10 minutes after each feed. Prone position care is beneficial with head end elevated by 30 to 45 degrees, but needs to be done only under supervision if it is done at home. For the initial few days, the mother must be advised to feed newborn baby once in every 2 to 3 hours, and later, once she is well adjusted in the feeding with the newborn, she can switch to demand feeding. These are the important points of a good attachment. The baby's mouth must be wide open, the chin should touch the breast, and the lower areola should be completely in the baby's mouth, and the upper areola may be visible, and there should not be any sound which should be coming. So the baby, if the baby is attached properly to the breast, then the milk transfer becomes easy, whereas on the right side you can see there is a poor attachment, and this will lead to poor milk transfer in the newborn. So as I have said before, demand feeding is usually practiced in the later stages. This can be picked up by the mother based on the feeding cues. The early cues are the baby is turning, mouth opening or seeking the breast. The mid cues are stretching, increasing movement and hand to mouth movements. The mother must pick up these early or the mid cues. Otherwise, if the baby goes for late cues, then the baby starts to cry, there is lots of movement and the color turns red, and this stage should not be reached. The baby must be fed when the early cues or the middle cues are being demonstrated by the baby. The few essential points to be remembered during breastfeeding are that night feeding is essential, because this will maintain the prolactin reflex. So the mother must be advised to feed throughout the day as well as in the night. The mother must continue feeding even when she is unwell, as this will transfer the essential antibodies to the baby. Coming to the skin care of the newborn, the parents must be advised to keep the skin clean and dry, especially the perineal area. Avoid the use of diapers as much as possible. Daily bathing or sponging is advised only if the weight of the newborn is more than 2 kgs. Avoid hypothermia in baby at all cost. Oil massage regularly is recommended. Commonly used oils are the coconut oil, and the mineral oils must be avoided. The applicant's hand must be clean, dry and warm prior to the oil massage, and these medicated oils which are available must be avoided because they can lead to skin rashes. Avoid powder, cream and beauty products on the newborn baby. Use of the cotton clothes is recommended. Avoid the use of antiseptics while washing the clothes of the newborn. Avoid the head, hands and feet from getting cold. Hence, the use of caps, socks and mittens are encouraged. Kangaroo care by mother or father or any relative is essential in the management of all low birth weight babies and must be explained prior to discharge from the hospital. Avoid less or excessive layer of clothing in the newborn to avoid the chances of hypo and hyperthermia. The skin of the hand and the feet must be pink at all time, which indicates that the baby's temperature is maintained. This is kangaroo mother care, where you can see the mother is holding the baby in the KMC. The baby is between the mother's breast and the baby's bottom is supported. The baby is in a frog leg position with the head turned to one side. This is a very beneficial low cost way of maintaining the temperature in the low birth weight babies. Coming to the eye care component, then clean the eyes with fresh clean water and avoid use of eye drops until it is prescribed, until and unless it is prescribed, because it also has its complications. Another important point in eye care is avoidance of the application of kajal, because that may also increase the risk of infection. Coming to umbilical care, usually a newborn's umbilicus will dry and fall off by day 7 to 10. Till it falls off, the umbilicus needs to be kept dry. Avoid the diaper to be placed directly over the umbilicus, because then the urine will soak the umbilicus and it will increase the chance of infection. Application of iodine or spirit to clean can be done if necessary. Avoid application of cream, ointment and powder on the umbilicus, and anything to be applied on the umbilicus, medicine should be prescribed and then only to be applied. In general, steps to avoid infection are: avoid crowded places, avoid contact from person with upper respiratory infection, hand washing prior to touching baby is a must, avoid unnecessary handling of the baby and timely immunization. These are the hand washing steps which was discussed in one of the previous lectures. So, the 6 steps are very important. First is palm to palm, then interlocking, interlacing, then both the sides front and back, then in the thumbs and rotation of the tip of the fingers. So, these 6 steps must be followed even at home by all the parents who are touching the baby. There are a few physiological changes which are present in the newborn, and the parents must be reassured that this is normal and not to worry. One is physiological phimosis in the male newborn. Another is white or minimal blood discharge from the female genitalia. This is known as withdrawal bleeding. And sometimes the newborn baby's breast may appear big, and if it is squeezed, then milk comes out from it, and this is known as witch's milk. This should never be done. If the breast size appears bigger in the newborn, it is because of the hormones which have transferred from the mother to the newborn, and they usually settle on their own. Then the milk should never be expressed, because this will lead to increased chance of infection and should be avoided. There are few other physiological changes like development of acne in the newborn, development of red colored rashes in the newborn, which is erythema toxicum. This is very commonly seen and is absolutely normal. So, these things should be explained to the parents if there is a doubt. However, the danger signs should be equally well explained to them, so that they do not spend time waiting, and the baby should be brought to the hospital if develops symptoms like poor feeding, vomiting or loose motion, abdominal distension, change in the baby behavior, excessive lethargy or irritability, respiratory distress or cough, cyanosis, fever more than 100 °F, or there is persistent cold peripheries, yellowish discoloration or decreased urine output. These danger signs must be explained in detail to all the parents prior to discharge for early pickup of the signs of neonatal sepsis, and this will go in a long way in preventing the mortality and morbidity associated with it. Thank you.